Hello, this is Dr. X, a doctor working here today. May I confirm your name and age, please?
Hello, doctor. My name is Patricia Wilson, and I am 49 years.
Okay, how may I address you?
Please call me Wilson.
Okay, Wilson, today we are going to discuss about your health issues. Will that be all right?
Okay, doctor.
During our conversation, I might take down some notes, which will be strictly confidential. Is it okay?
Okay, doctor, no problem.
Now, Wilson, can you please tell me what has brought you here today in your own words?
Yes, doctor. About 2 hours ago, I was going home on foot after taking my lunch at a restaurant, and then suddenly I developed pain in my chest, and there was also some discomfort along with the pain. I feel also some heaviness in my left arm, and at that time I sat down. The pain somewhat eased a bit, but after I then again I started walking, and then the pain again come, and the pain was much severe than the first episode, and the pain was lasting for about 20 minutes. And also, the one thing that initially the pain was severe, and after a few minutes, pain was somewhat eased, and after 20 minutes of taking rest, the pain totally went away. And now I don't feel any problem. But that pain worried me much.
Okay, so you're telling that at the beginning, pain was more severe. Is it right?
Yes, at the beginning, pain was severe, and after taking rest, it was somewhat better.
Okay. You told me that you at the beginning it started just after having lunch. May I know that what were you having in the lunch today, if you don't mind?
Regular restaurant food like a pizza, some sauce, and a chicken burger.
Okay, okay. That's your regular food.
Yes, that I usually.
Okay, okay. That's all right. That's all right. You told that there was pain. Which was severe. Well, can you tell me that did it come suddenly, all on a sudden?
Yes, doctor. It came suddenly without any prior notice, or I didn't feel anything before that. Suddenly the pain came.
Yes, yes, yes. And it spread. You told that you felt some heaviness in your left arm. Did you
Yes.
feel that it went to your cheek or uh, jaws? This
No.
pain.
No.
Okay, okay. And for how long did told for the first episode? For how long did it persist in the first episode? That pain.
First episodes, I took rest, and that persist for about 2 to 3 minutes. After that, it went away.
Okay, okay. First episode was lesser, 2 to 3 minutes. Okay, okay. And can you please tell me approximately after how much time the second episode started?
After the first pain went away, then I took some rest, and after that I started walking again, and after a few steps I again felt the pain.
Okay, and how about now? Are you feeling the pain now again?
No, I am fine now.
Okay, and can you describe the pain for me, please? Next pain.
Okay, the pain was something, some heaviness with some tightness in my.
Okay, okay, I get it. Was it throughout the whole chest or any specific part of the chest?
It was at my midpoint and also my upper stomach.
Okay, okay. And did you feel that this pain spreads to your back?
No,
Any backache? Okay.
no,
And okay, okay. Besides taking rest, did you notice any other thing that has relieved your pain?
no. I cannot remember much.
Okay. Before the pain started, can you please tell me that did you have any episode of vomiting?
No, but I felt nausea during that episode. No vomiting.
You felt nausea. Okay, I get it. For how much time? Just before chest pain or at the same time?
At the same time, when the chest pain came.
Yeah, yeah, yeah. Can you notice that did you had any sweating episodes during the chest pain?
No.
Okay. And okay. And well, since that pain came along, may I know that how have you been? How has been your water work?
Fine.
Okay. And okay, that's all right. Well, along the chest pain, do you have you been feeling any racing and pacing of your heart?
No.
Okay. Any shortness of breath?
No.
Any leg swelling?
No.
Okay. Any cough?
No.
Okay. Any noisy chest?
No.
Okay. And okay. And may I ask you some other questions? Uh, well, do you have any headache?
No.
Okay. Any changes in your vision?
No.
Okay. Any rash anywhere in your body or in your mouth?
No.
Any joint pain?
No.
Any raised temperature?
No.
Okay. Any how about your bowel movements? May I know?
It's okay, doctor.
It's okay. That's very good. Well, may I know that have you ever blacked out?
No, but during that episode, my daughter said that I looked somewhat pale. I didn't black
Okay.
out.
You were with your daughter. Okay. Okay. And uh, well, could she notice when you again came back to normalcy? This color change, paleness, recovered.
She just said that during the pain I had this.
Okay. Okay. You looked pale. Okay. Okay. Okay, that's all right. And okay, that's all right. Well, may I know some history? That do you have anybody in your family with any long-term diseases?
No.
Okay, any sudden death, history of sudden death in your family?
No.
Any history of diabetes or high blood pressure in your family running?
No.
Okay, any problem in your blood lipid level? Do you know blood cholesterol levels?
No.
Okay, may I know some ask you some personal questions? Do you smoke,
Yes,
Wilson?
doctor.
Okay, may I know how many sticks per day and for how long?
About 10 sticks per day for last 25 years.
Okay, Wilson, actually, it's very harmful for your health, and it would be better if you just cut it down. And if you want, I can refer you to the smoking cessation unit. Will it be all right?
Okay, doctor.
And how about alcohol? Do you drink alcohol?
Yeah, yes, doctor, but not so regularly, just only at special occasion.
Just for special occasions. Well, has there been any recent binge drinking of alcohol
No.
recently?
No.
Okay, that's all right. That's very good. May I know that? I'm sorry to ask it, but I have to ask. Do you take any sorts of recreational medication?
No.
Okay, and well, okay, that's very good. And may I know that do you drink excess? Do you drink a tea or caffeine, coffee?
Not regularly, but sometimes maybe one or two cups a day.
Okay, okay. And well, that's very good. And okay, and may I know that whether you have been to any travel to any countries recently?
No.
Okay, and okay, and how about your job?
I'm a school teacher, doctor.
Okay, okay. And well, may I know that have you been under any stress?
No, I don't think.
Okay, okay, okay. And may I know about your personal medication history? Do you take any medication for any diseases? You know,
No, I am not taking anything. Just take
you are
some
not taking
vitamin preparation.
vitamin. For what may I know?
And sometimes I feel that I need to take something that will keep me fit. So I only take those.
Oh, okay, okay, that's all right. And are you allergic to any medication?
No, I don't know.
Do you take over the counter medication
No, I don't take.
apart from this vitamin? Okay, any herbal medication?
No.
Okay. May I know one thing, Wilson? That whether is this the first episode that you are having this, or have you ever perceived this type of feelings before also?
Yeah, about 5 years ago, doctor, I had some pain that was also came following taking a meal. And at the time I visited my GP, he has tested and did some scanning of my tummy and said that there are some gallstone. And also I underwent surgery for that.
Okay. Okay. So, and you underwent surgery for that. Well, after that surgery, have you been under regular checkup?
No,
Okay, that's all right. And after the since that 5 years, you didn't feel any pain in your tummy or anything like that.
no.
Okay. Okay. And okay. And well, may I know that whom do you live with?
I'm living with my daughter.
Okay. And well, are you well supported socially or economically?
Okay, doctor. There is no problem with that.
Okay. And okay. And may I know that? Well, you told that you had some similar type of chest pain 5 years back, but did that time your pain moved to your arm like this time you
I
told?
cannot remember much.
Okay, okay, that's all right. That's all right. And may I know some other questions? This very private one, but I have to ask: do you have a partner, or are you sexually active?
Okay, doctor. I am a married person and I have a husband, and but he
Hello,
moved away.
hello.
Yes,
So,
I'm living with my husband.
yeah, yeah. Okay, that's all right. But again, I have to ask you. It's a bit embarrassing. But please cooperate. Do you have ever any type of a casual relationship?
No, never.
Okay, that's all right. That's all right, Wilson. Well, may I know what your concern is, Wilson?
Okay, doctor. Why I am having this pain? Does this pain related to my operation that I needed 5 years ago, or is it something serious?
Okay. Well, well, at this moment, it's we at the beginning. I have to first examine you properly and assess you by by doing some blood tests and other tests. But at this moment, it's quite difficult to tell for sure that what has caused your symptoms. But as long as I have taken a history from you, uh, it might uh, it is might be due to some causes of your chest or tummy. Both can be possible. But I have to run for some tests for this, for some blood tests and also some scanning tests of your heart, some tracing of your heart, and also at the same time, we might need to do some tests to look into your food pipe, and we can and at the same time we would like to keep you under close observation, so that you do not deteriorate, and we can treat you for the time being, as well as running the tests. Are you getting me, Wilson?
Okay, doctor.
Do you have any more concerns?
No.
Okay. So thank you, Wilson.
Okay, thank you. So, what is your diagnosis for this lady?
Well, uh, I think that this might be a case of Boyer syndrome. I'm not sure, but just she has had actually a heavy lunch, I think, and just after that she's having the chest pain. So I'm not sure that whether it's Boyer syndrome or not. It can be, I think, and also since the first episode was much more
Hello. Hello. I cannot hear you.
Hello,
Yes, I can hear you now.
are you with me? Yeah, yeah. And also, since the first episode of Pain was actually much more severe, so I think that this might be a case of dissection also. Okay, coronary arterial dissection also. Okay.
Do you think it can be a case of stable angina or
Uh, I think it can be a case of unstable engine as well.
can it be a case of myocardial infarction?
Yes, it can be, but usually the beginning episode of MI might not be that severe. So I'm at a loss that whether it should be brought at the beginning, but it can be.
Okay, you have not included that. And also, okay, and I am coming to the history taking. The history taking, she had chest pain. Initially, you should have asked about the site. You asked it very late. Then
Mm-hmm.
onset, criteria, radiation, associated symptoms, any shortness of breath. You asked, but that was very haphazardly.
Yeah, yeah,
And also timing, eliciting factor. Here, eliciting factor was exercise. He already told you that when he started walking, then he felt then she felt the pain. Also, relieving
yeah.
factor. She told you that taking some rest make some relieving factor, and also severity. You haven't asked
Mm.
about the how severe was the pain.
Yeah. I think I asked it.
I cannot remember.
Okay, okay.
And another thing that if you think it is a case of cardiac, then you should have asked about the ischemic symptom. You haven't asked it that did she had any history of exertional dyspnea? Then
Hmm.
how any symptoms of heart failure? You haven't asked.
I think I asked. Look, like, what should have more should have been asked.
About how many pillow does she use at night?
Oh, yeah, 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 yeah,
Any
yeah, yeah,
shortness of breath at night? Does she have to wake up at night due to shortness of breath?
yeah, yeah, yeah.
Any history of leg swelling?
Yes, I asked leg swelling, but didn't ask all others.
Okay. And after that, you have asked about the risk factors. Okay. And also there are some other factors that can be case of biliary cause, though unlikely, and also can also be a case of peptic ulcer disease.
Yeah,
Can be a case of
yeah. So
aortic dissection.
for aortic dissection, what should have I asked more? I asked about the back. If it related to the back, anything more?
No, nothing unnecessary important other than clinical examination.
Okay, okay.
And you have asked about other systemic query. I cannot remember much if you have asked went through systemic query well. And also, yeah, as
Okay.
you think it is a case of coronary disease, so you should have asked about the risk factor. She had some risk factors that she has history of smoking
Yeah, yeah, yeah.
and other.
I told
And
she
also,
told me. And
also if you have asked, I could tell you that yes, at my if I feel any problem at work, then I could tell you that I cannot cope up with my job as like before, because I feel shortness of breath after taking a few class or after hurrying up.
Yeah, yeah,
I
yeah,
didn't feel
yeah,
that
yeah,
now. I didn't feel that before.
yeah. Okay. Yeah,
And in the past history, you have asked it well. Then in the drug history, that was fine. Family history was fine. Personal history, that again was very haphazard. And in this case, sexual history isn't something important, I think.
yeah,
And driving issue was an important issue. You haven't asked it. Okay. And
yeah.
another thing I forgot that I can I wanted to tell you, but I forgot to mention.
Okay, just tell me later on if you remember. Okay. Okay, and well, I think the case was of stable angina. Is it right?
uh, just angina and probably stable angina, because her symptoms went away after taking rest on first episode, but on the second episode it didn't. It lasted for about 20 minutes, so it can be
Yeah.
a case of myocardial infarction also.
Mm-hmm. Yeah, yeah, yeah. Okay, that's very nice. So I
And also,
think that's all for today.
and also female patient. For female patient, you haven't asked about her pill period or pregnancy.
Oh, such a foolishness. Okay. I
I
should have
wanted.
asked.
Yes.
Yeah,
She's
pill
taking oral.
pregnancy.
She's taking oral contraceptive pill. That is also another factor.
Yeah, 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 yeah. Okay, okay, okay. So is that all for today? I think.
Okay.
Okay. So goodbye. Good night, Mr. Vishesh. Okay.